Type 2 diabetes. A strict diet eliminates the need for treatment. If followed for life, this diet can achieve normal blood sugar levels without the need for medication. The results appear spectacular, even though it was well known that significant weight loss could lead to remission of diabetes. Boris Hansel, diabetologist-nutritionist at Bichat Hospital, "It's a very good study," comments Dr Boris Hansel, diabetologist-nutritionist at Bichat Hospital, Assistance publique-Hôpitaux de Paris. "The results appear spectacular, even if we knew that significant weight loss could lead to remission of diabetes. For about 10 years now, bariatric surgery for obesity has shown that it is possible to normalize the glycemia, blood sugar level, of severely obese diabetics, by making them lose several tens of kilos." At the start of the year, Le Figaro referred to the work of a team from the Clinical Research Institute of the University of Montreal which, thanks to intensive treatment with insulin, oral anti-diabetics and diet, was able to achieve sometimes to normalize early type 2 diabetes. Diabetologists prefer to talk about remission rather than cure, because of the lack of perspective. No more than a few months. Severe diet. This time, researchers wanted to see if the same glycemic benefit could be obtained with a strict diet. The results of the study, led by Professor Roy Taylor, University of Newcastle, and Professor Michael Lean, University of Glasgow, were published on December 5 in The Lancet. General practitioners in 49 primary care centres in the UK have enrolled 306 volunteers with diabetes and severe obesity, 35 body mass index on average, or over 101 kg for a person of 1.70 meters, and placed half of them on a very restrictive diet, or no more than 850 calories per day in the form of meal replacements, for 3 to 5 months, followed by a gradual reintroduction of food. The other half of the volunteers served as a control group, benefiting from the usual dietary and hygiene advice. All were then accompanied for a year. On average, people in the intensive diet group lost 10 kg and almost a quarter lost at least 15 kg. Importantly, remission of diabetes was observed for almost half, 68 out of 149, of them, against only 6.4% in the control group. It is true that the average weight loss was only 1 kg in the latter. In total, remission was noted in about 9 out of 10 patients who lost 15 kg or more, and in 3/4 of those who lost at least 10 kg. 17% dropouts. This study confirms that weight loss makes it possible to improve type 2 diabetes and even to obtain its remission in certain cases. Professor Bruno Verges. This shows that it is possible, with regular monitoring, and above all that it is possible to stabilize weight loss after the intensive phase, which had never been demonstrated in a study until now. This shows that it is possible, and above all that it is possible to stabilize weight loss after the intensive phase, which had never been demonstrated in a study until now. Professor Bruno Verges. But be careful not to get carried away. It is not that easy to follow a very low-calorie diet. Pr. Verges. Moreover, in this study where the volunteers were very motivated at the start, 17% abandoned the diet along the way. A crucial point also raised by Dr. Hansel, who recalls that the role of the doctor is decisive in the initial identification of patients. Be careful not to generate guilt in people who do not manage to comply. It is necessary remember that obesity is a disease and that it is normal to have difficulty following such a diet. Thanks for watching. Like, share, subscribe.